So yeah, the subtitle, I heard a little chuckling. As more and more states liberalize their laws, the odds are pretty high you're going to run into this. So we're going to talk about what this is, where it is, why it is, and then what the heck you can do about it. First of all, what is this? It first was described in 2004, not very long ago in medical terms, right? And there were these 9 people who they found had chronic use of cannabis for years, and then had this weird thing. They'd come in, they'd have these cyclical episodes of vomiting, last a day, 2, maybe 3, always taking really hot showers, great in the shower. As soon as they got out, right back where they were. And like 3 or 4 months later, the whole thing would start again. It was a strange setup that people hadn't really put together before. They started calling it Cannabis Hyperemesis syndrome. So, shocker, ready for this? People like smoking weed. I know. Who would have thought? It's the most used substance in the US, and about 12% of Americans will fess up to it, so who knows, right? Could be double that. And then in terms of the rate of cannabis hyperemesis, if you haven't seen it, you're thinking, well, is this really gonna hit me? So Colorado actually looked at their incidence, and they looked at total ED visits, so it was still less than 0.1% before and after liberalization, but the incidence did double after they liberalized their marijuana laws, and this was looking at up to 2015 was when the study was published by Dr. Kim and colleagues. So it's probably even higher now. So it does make an impact once you liberalize those laws to have more people presenting with cannabis hyperemesis syndrome. So what exactly is causing this? There's a lot of controversy over that. So there are cannabinoid receptors in the brain, cannabinoid receptors in the gut. There's a thought that maybe there's this strange regulation going on with when you're smoking a lot of cannabis or ingesting it, doesn't matter the route, that you can cause this vasodilation to splanchniks, but then the heat maybe vasodilates, and it's not really clear. There's also this thing called the transient receptor potential vanillinoid 1 receptor. I didn't pick that name. But anyway, these TRPV1 receptors are inside the brain, and they respond to heat. And that's why we're going to talk about this weird treatment. Ooh. You're going to manage with rehydration, evaluate it for AKI, and treat the emesis with, of all things, capsaicin. So the thought is that you have this regulator in the brain for temperature, and by putting capsaicin on, it overstimulates these receptors, and then causes them to have decreased emesis, decreased nausea for them. The nice thing about the capsaicin is that they can take this home with them. So the alternatives, you may want to tell them to stay at home and sit in the bath for 2 days. That ain't going to work. You can do ondansetron and meclopramide, but the problem is it doesn't last beyond that initial bit of help, and I'll tell you, it doesn't even help that much in the very beginning. And then Haldol actually works pretty well. The difficulty with that is that you get them all settled out in your ED, they're finally chilled out, and the Haldol wears off, and they're right back. I'll tell you, so I was practicing in California for a while, and the bounce rate on these patients was easily 50%. You get them all set up, they were easily signed out from like 3 different people, right? One physician to the next one is trying to keep them from being admitted, and then like 8 hours later they bounce. So the capsaicin is actually a very good way to keep them from bouncing. And then if you want, you can try some Ativan for them as well. And of course, stop using cannabis. So the summary on this is that it's easy to temporarily relieve these symptoms, but the problem is maintaining them. What you want to do is keep cannabinoid hyperemesis syndrome in your differential. A lot of times, right, they'll initially deny any drug use. I was just talking to a friend this morning about this topic, and they honestly think of it like as a vitamin. It's just not conceptually a drug to a lot of these folks. And so specifically ask if they've been coming back with emesis, do you ingest in one way or another cannabis? And then protect the kidneys, check for, give them lactated ringers instead of NS, if you've read the New England article from a couple weeks ago. And then check a BMP. Sometimes they can have some AKI from this if they've been vomiting a ton from this. And then if you want, you can shotgun some ondansetron and metoclopramide, but really you're going to want to try for Haldol, Ativan, and capsaicin on the abdomen. And that's the way to hopefully get them packaged up to head out of your ED. Yeah. Yes, sir? So our pharmacy stocks it, thankfully. I've also heard of people just running across the street to a pharmacy. Another question, sir? Yes, it does. So the question was, does the capsaicin burn And so, yeah, that's one of the, you have to kind of prep them that their abdomen's going to feel very hot, just like if they were to use it as normal. That's a great idea. I've not heard people trying that, but I'm going to rob that from you if I may. Yes, ma'am. Great question. How often do you tell them to apply it? They just follow on the back. I think it's every 4 hours. Great question. Yes, sir. Great question. Why put the capsaicin on the belly? It's because that's what's been reported. But they actually mentioned in a couple of articles you could put it anywhere. It's just an easy location to get to. And I would offer the question was also about the vasodilation and such. There seem to be two different camps buying into the vasodilation and the cannabis receptors, another camp with the transient receptor potential phyllenoid 1. I had to practice that, so I wanted to use it again. That's a great question. I haven't seen people clarify exactly how long the washout period is. What people have reported is that most of the time this conversation doesn't actually produce results. Yes, ma'am. The description is usually about a year. There was one case report I saw where they got down to like 8 or 9 months, but the majority have been people who've been smoking chronically for years. And the thought is that it also builds up because they've been smoking for a while. Most of these patients have been increasing the total amount, not just the amount of time for years, but also maybe started once a week and now once a day, and it builds up after a while. Great question. Yes, ma'am.
Anecdotally, I feel like it's more men who are affected, but when I've done researches, that's not borne out. But what have you found?
It's a great question. So the question is, does it affect men more than women? And you're right. Now that I'm thinking about it, I haven't seen that explicitly described, but in the case reports I'm thinking of, there was a slight majority for men. I don't know if that is because the incidence of cannabis ingestion is higher in men than women off the top of my head, but now that you mention it, all the ones I've treated are male. Good question. Yes, sir. Plenty of women in the Bronx, he says. There's another question up here? No? Yes, sir.
I work in Colorado.
Oh, great.
Men are heavier smokers, more lifestyle.
Thank you. The gentleman works in Colorado, front lines of this, and says that both men and women will be smoking, but the men seem to be smoking heavier, or ingesting heavier, it sounds like.
The other thing is they're all in denial. They cannot accept this as a diagnosis.
That's another thing that was pointed out. He says they're all in denial, and so they don't want, oftentimes, and this has been reported, that they don't make that connection. They don't want to accept that the marijuana smoking is impacting them in this way. I'm sorry, that must be my time is up. You're standing there.
Yep, you got another couple minutes.
Okay. Other questions? Yes, sir. Just the standard, so normally it's like a quarter full. You just spread it out. It's as easy as following the instructions as on the back of the container. Great question. The question was how much to put on. Other questions? From what, sir? Great question. So the question is, how do you distinguish this from cyclical vomiting, which is a kind of nebulous term in general anyway, and the suggestion from the various articles is just pinning it down to whether they have any marijuana use. And if that's the case, then trying these specific alternatives. If they don't work, then you're probably leaning more towards a diagnosis of cyclical vomiting. Thankfully, these sort of therapies are fairly harmless. I mean, yeah, we're all watching the QTC on Haldol, but realistically, a few milligrams is not that big of a deal.